Thank you, Phil. Can everybody hear me okay? Well, good morning, and thanks for having us here today. So what I'd like to do is tell you a little bit about Trinity Health and what we're doing in order to manage and balance the ongoing, I would say, tension between being a provider-based system where we have the episodic health care, population health, and community health and well-being. So Trinity Health is a faith-based organization, Catholic, based out of Livonia, Michigan. We're a $19.3 billion organization, and we're spread across 22 states, and we divide those up into 19 regions. And our mission, we came together, Catholic Health East and Trinity came together under the Trinity umbrella in 2013, and our mission very clearly stated is to be a transformative and healing presence in the communities that we serve. So in order to live out that mission, we created this vision that you see in front of you, which is to create a people-centered health system that delivers the triple aim: better health, better care, lower costs for individuals, populations, and communities. So again, three kind of core activities: the episodic care, and we think of that as kind of the fee-for-service, the fee-for-service care that we provide at an individual basis. The population health. So that's really now trying to create the incentive around moving to value-based care and moving to alternative payment models. And then community health and well-being. And we've really kept those as key criteria in front of us as we build out the healthcare system. We're still pretty new at it, quite honestly. We just came together in 2013. And the new board that was formed, creating that mission, that was new as well, a transformative healing presence in the communities that we serve. So, so that was the way that we organized ourselves to create the management alignment, as well as what I'll call the priority strategic aims and the incentives for the individuals that run the organization in order to achieve those. So our journey towards community health is aligned around three key focus areas. One is on the top right, it's transform communities through policy, system, and environmental change. Then to the left, ensure care delivery models that assess and address the needs of the vulnerable patients. And then third, to expand utilization and availability of community-based services. So that is the approach that we take towards the Well Community Initiative. Oh, there we go. And we have three strategic initiatives that are our main focus: addressing the social influencers of health. So we call them we've gone from social determinants of health to social influencers of health, and Ben brought up the social drivers of health. So we haven't gone there yet, but we're at the social influencers of health. So we target that. It's very community-based, and we address at least one social influencers of health for each community, and each community is different, as you all well know. And then across the system to reduce tobacco use and to reduce obesity. We're also investing in communities using policy, system, and environmental change strategies to improve health. On the left, you can see kind of some of those key transforming communities initiatives. Started in March of 16, we've done in 8 locations. We've provided $18 million of grants, and $7 million has been matched at the community level. And we also have $40 million in community loan investing. So as we address housing, as we address food, as we address transportation, we're using the grants and the community loans as ways to influence that. And you can see at the bottom, we have a number of different partners that we work with. One example of this is in Springfield, Massachusetts, where we've partnered with Sodexo and the public schools to create a culinary and nutrition center. And this is really a $21 million project serving the Springfield public schools, where 100% of students qualify for free or reduced lunch and breakfast. And it's a way of addressing, one way of addressing food deserts and shortage of foods for our children there. Another example is the Wellspring Greenhouse, which is another collaborative providing local fresh produce for hospital operations. Another community partnership as well. So those are a couple of the examples of what we are, and I know I'm going a little bit over my time. Sorry about that. But in terms of health equity, we also focus in 4 areas, which is to assess the delivery of equitable care, develop equity plans, provide cultural competency education, and reflect diversity in our communities. And we do that through employment, through vendor relationships, through using various means of purchasing from local and diverse organizations as well. And we really want to be reflecting the communities we serve in that regard. So those are end my comments. Consuelo?